Hey everybody, Dr. Matt Symons from Palm Beach Health Center. I want to talk to you today about the risks of spinal adjustments. There's no shortage of people that come into my office who are really interested in chiropractic care, but they're worried, and nervous, a little bit apprehensive about getting their neck adjusted. So I just want to make sure that everybody gets a little sense of what's real and the significance of the whole neck manipulation and adjustment issue, and see if we can get some of the record straight all about that. So to begin with, you've probably seen Hollywood images and movies that make it seem like all you have to do is go up to somebody and just go bam, like Arnold Schwarzenegger, and then their neck is broken. The reality is that's very Hollywood, but it's unbelievably difficult to break someone's neck, even if you wanted to. You probably couldn't do it if you tried. So it's not the kind of thing where you can just go up to someone, blow hard at their face, and all of a sudden their neck breaks off. That's just a very Hollywood movies and lights type of thing. It does take a whole lot of serious effort to try to hurt somebody's neck, and even then you probably couldn't do it. Your body is really more durable than you think. That's why you can have football players who can go out there on a weekly basis and just put their heads down and ram into somebody as hard as they can to try to knock them down, and their neck doesn't break. So the reality is, it shouldn't happen that way when it comes to football, but it does all the time, even in the younger age groups. So that's why your kids can fall off jungle gyms and they don't break their necks. If we just broke our necks all the time over every little thing that might happen to us, number one, you wouldn't be able to get a chiropractor to open up an office because there'd be too much risk and too much danger, and they'd be getting sued left and right. And number two, there probably wouldn't, there'd be laws up against it. But the truth is, it's an unbelievably safe thing to do, is to adjust somebody's neck properly with the right amount of force. So how safe is it? I think one of the best ways to describe how safe it is to look at what the costs are. Because insurance companies, when it comes to their actuaries, when it comes to their adjusters, they know exactly what the risks are of something, so how to know what to charge you. In other words, if you're a crazy, scary, reckless driver that's running red lights all over the place and running stop signs, going 90 miles an hour everywhere, then you know your insurance premiums are going to go up, right? You get tickets. Those tickets cause points on your license. Those points cause your insurance rates to go up because you're more likely to be the cause of an accident and more likely to make an insurance company have to spend a whole lot of money on you. On the other hand, if you're a very safe driver and you have very little or no risk of any accidents happening, then your insurance premiums stay pretty low. And you can use the same kind of analysis when you're looking at how safe something is in the healthcare world. Because we have, of course, in healthcare, we have to buy our malpractice insurance as doctors. So the average general practitioner, the average medical doctor that's going to see patients throughout the day for everything from, upset tummies to colds and so on, they'll typically have a $1 million malpractice policy. And that $1 million practice policy will typically cost them, on average, about $30,000 per year. And that's with a clean record and with no previous lawsuits. They're going to spend about $30,000 a year. There are certain specialties that have much higher premiums than that. So for example, anesthesiologists have a really high malpractice premium for what I've been told is around $100,000 a year just to start with for those guys. And same with obstetricians or OBGYNs. It's also around $100,000 a year for them. And then there's a lot more risk in these sort of things, or at least in the way that that's being done. But my malpractice insurance, I also have about $1 million practice insurance policy like those medical doctors that we just talked about. And that $1 million malpractice insurance policy costs me $1,200 a year. And that's after 20 years of practice. When I first got out of school 20 years ago, it was around $600 a year. It's always less expensive when you're first getting out of school because, of course, you haven't had those years of practice where somebody might come back from 7 years ago and say, oh, he hurt me. And then also there's that theory when you're fresh out of school that all that knowledge is freshest in your head, so the insurance companies make it lower for you when you're first getting out of school. So there's all these kinds of things that we talk about when it comes to insurance. So the insurance providers typically give the best rates to people that are fresh out of school, and the longer you've been practicing, the more time that there's been, and obviously everything goes up. So around $1,200 a year is still really, really inexpensive. In fact, The car that I'm driving right now costs me more than $1,200 a year to insure it. That's how safe chiropractic care is. Safer than anything that's being done in any medical doctor's office, safer than driving a car. It's unbelievably safe. It's safer than taking an aspirin. So I'll have another video coming up in a little bit where I'll talk about the reality of the issue of, can chiropractors cause strokes? Because that's another myth that some have tried to convince the population for a really long time. And I want to debunk that and assure everybody that you understand the science behind what can happen there. There was a pivotal research study that looked at what was going to actually create that, and I'll go into that in my next video. I really hope today's information makes you feel more confident, more comfortable, more relaxed, that the risk of chiropractic care is really, really small, while the benefits can be outstanding.